A new Omicron variant currently accounts for about 4 out of every 10 confirmed COVID-19 cases across the country.
According to the CDC, the strain known as XBB.1.5 is spreading very quickly, and Fox 4's Alex Boyer has more tonight. Alex.
Hi, guys. Yeah, the percentage of new COVID cases related to this Omicron subvariant have jumped by double digits since Christmas Eve. Now, the CDC does say that it appears that this variant is more contagious. Cases, as you mentioned, right now are really surging in the northeast part of the country, but doctors expect that it'll start spreading across the rest of the U.S.
With millions of Americans now back home after traveling for the holidays, cases of a new Omicron subvariant are starting to emerge in parts of the U.S.
And I think what has caught everyone's attention here is that it can evade the immune system.
Dr. Nikhil Bayani is an infectious disease physician with Texas Health Resources. According to the CDC, the so-called XBB.1.5 variant accounts for approximately 41% of new COVID cases. That's up from 21% reported on Christmas Eve.
So the number of cases have gone up, and also the hospitalizations.
The variant is primarily being seen in the Northeast, but is expected to spread across the rest of the country.
Well, I think anytime you have a new variant, you certainly want to be concerned.
Stephen Love is the president of the DFW Hospital Council. Love says there are currently some 975 COVID patients hospitalized in Trauma Service E, which includes North Texas. That number is up by some 200 from just last month.
The latest statistics on Texas show that this new variant, XBB.1.5, is clearly here, but it has not grown the way it has in the Northeast.
Still, Love says the council is monitoring the variant closely as local hospitals continue to struggle with staffing shortages and burnout, treating COVID and other respiratory illnesses.
The flip side of that is sometimes staff get sick, and so that compounds your overall workforce.
Early evidence shows the new bivalent vaccines are helping to protect against this new variant, especially for the most vulnerable populations.
Overall, look at the vaccinations, the boosters, hospitalizations have decreased substantially. And also, it has prevented deaths. So there is some degree of protection.
And I asked Dr. Bayani if he had any advice for folks. He says really just stay vigilant at this point. He says take steps to prevent yourself and, of course, the people around you, especially vulnerable relatives and friends. And he says, of course, if you're in a large setting, especially indoors, it never hurts to wear a mask. Back to you.
All right, Alex, thank you.